Several years ago, a group of researchers at Harvard, the Harvard School of Public Health, came up with a study that is described now as the 8 Americas study. They looked at all of the data that we have on life expectancy and discovered that there isn't just one America in terms of life expectancy. There are 8 different ones. That life expectancy varies in this country based on your race, your ethnicity, or your geographical location. And it really produces some unique patterns. At the high end, for example, if you're an Asian American baby girl born today in the Northeast, New Jersey, and even this vicinity, your life expectancy is upwards of 90 years. It's close to 95 now at birth. Some of the longest longevity of the world. By contrast, if you're a black male baby born today is going to have an average life expectancy of just shy of 69 years. And if you're living on an Indian reservation, you're going to have a life expectancy of 58 years at best. So there's as much as a 33-year difference of life expectancy in this country, depending on who you are and where you are. The main reason for that is sharply different rates of chronic disease. In the end, all Americans are dying mainly from several big factors: cardiovascular disease, heart disease, number 1, cancers, number 2, and so on. But those conditions hit the different populations at different rates, different prevalence, and also at different stages of life. For the most part, for these populations with low life expectancy, they hit much earlier in life. Now, that data that I just showed you was up to 2000. What happened from 2000 to 2007? Well, I'm sorry to say things got a little worse. If you compare all of the counties in the United States, there are more than 3,000, to an international standard of life expectancy in the 10 nations in the world that have the lowest mortality and the longest life expectancy. We're not one of them, but if you compare us to those sort of gold standard nations, it turns out that from 2000 to 2007, in 80% of counties, we fell against that gold standard in terms of life expectancy in men. And in 91% of US counties, we fell against the standard for life expectancy in women. So in large numbers of communities across this country, health status is getting worse. And again, a lot of it is due to those things that I described earlier. It's obesity, it's smoking, it's cancers that set in earlier than they should, or if at all, it's heart disease, etc. And now there are big variations among the population, but the overall picture is not good. And again, just to drive home this point a little bit more, what really are the drivers here? It's heart disease, a leading cause of preventable death. Tobacco smoking is still killing a lot of people in the country. That combination of poor diet and physical inactivity, and even alcohol consumption. Big drivers of preventable death. Now, in addition to that, we also know that these disparities in life expectancy continue to get larger. And they are also, in addition to being correlated to behavior, they're also highly correlated to education. And we just last month published this study that looked at life expectancy in 2008, depending on your level of education. And it turns out that in 2008, adult men and women who had fewer than 12 years of education, who didn't make it to the college or university level, didn't even graduate from high school, they had life expectancy about the same level as all American adults had in the 1950s, 60 years ago. So it is like they were living in the 1950s, in an era even pre-Elvis in terms of their life expectancy. And then when you combine race and education, you see these disparities even more strikingly.